We find ourselves in a busy emergency room around 6:30 p.m. The ER does not have a fast-track clinic area. Mrs. Stewart and her daughter Paige are waiting to be seen for Paige's cold symptoms with a worsening cough. Paige's pediatrician's office doesn't have any appointments available for the next 3 days and instructed Mrs. Stewart to take Paige to the ER if she was concerned. When Paige is triaged, she is categorized as non-urgent. Mrs. Stewart is told that she may continue to wait, but the wait time could be up to 4 hours, as more urgent and emergent cases would be seen first. The triage nurse encouraged her to wait for an appointment with Paige's pediatrician and also gave her a list of community clinics with availability of who takes Paige's insurance of Medicaid. Mrs. Stewart is concerned about Paige going to school the next day and missing work herself. The triage nurse has asked the nurse practitioner to speak with Mrs. Stewart. The nurse practitioner needs to keep EMTALA laws in mind, as well as other legal and ethical implications.
I am very upset that my daughter can't be seen right now. She's been sick for several days, and my doctor's office told me to bring her in. If I wait for 4 hours, we'll be tired tomorrow. It's too late to go to another clinic. I'll have to miss work tomorrow. Paige will miss school, and I could get in trouble with my boss.
I understand that you are upset about the wait time for Paige to be seen. It sounds like you're concerned about your daughter's health, as she's had these symptoms for several days. I hear that you are also concerned about missing work and Paige missing school. Is that right?
Yes, I'm very concerned about my daughter, and her doctor told me to bring her here.
I can understand that you're feeling that way. I think anyone in your position would feel the same way. Would you mind if we sat down and talked just for a moment?
I guess.
Thank you for giving me this opportunity. First, I want to acknowledge your concerns. I applaud you seeking out your primary care provider and following through with their recommendations based on your concerns. You are doing a wonderful job of taking care of Paige.
Thank you.
I also understand my triage nurse gave you a list of community clinics who take Medicaid. Is that right?
Yes, she doesn't want to take care of us here because she is busy. She just brushed me off, tried to send me away.
I'm sorry that is how it came across. May I clarify?
You seem kind and like you have Paige's best interest in mind, so sure.
Generally, emergency rooms are used for things that can't be handled in doctor's offices. We have to see the very, very sick people first by law, which means people who have a valid concern that isn't life-threatening have to wait a little longer. My triage nurse wanted to make sure you get the very best care for Paige's condition. So a community clinic was an appropriate referral, not because she didn't want to take care of you, but because it is a better use of your time and resources, and it keeps you and Paige away from people who may be a little worse off with their conditions.
Well, that makes more sense.
If you keep this list of clinics, you can utilize them the next time Paige is sick. Then you won't have to risk exposure to all these sick people, and you won't have a 4-hour wait.
I see. That's a good idea.
Based on that information, do you want to continue to wait here, or would you like to make an appointment with a clinic?
I think I'll go ahead and take her home so we don't get sick from all the people here. Is there anything I can do tonight to help her feel better so we don't miss school or work?
I definitely appreciate the chance you've given me to clarify. Yes, I can give you some ideas to make it through tonight. First, it's a good idea just to raise her head when she's in bed to help with any drainage. You can also use a humidifier at night. You can try over-the-counter antihistamines or decongestants, making sure that you follow the instructions on the labels. Also, Tylenol and Motrin can help with fever and mild discomfort. If Paige does develop a fever of 103 or greater, or she develops a fever that doesn't come down with the use of medication, or if her cough gets a lot worse, you should come back here to the emergency room and not wait for the clinic appointment. I know that that is actually a lot of information, but could you possibly tell me what I just told you?
Yes. I can make sure that her head is raised up when she's in bed. I can use a humidifier to help with her cough, and I can get some medicine on my way home. But I need to make sure to read the directions on the bottles carefully. I should bring her back here if she gets much worse, or if she has a high fever that won't go away with medication.
Exactly. I wish all my patients were as attentive as you are. I appreciate your time and your listening and just being receptive to us talking. I'll let you get out of here so you can get home and get Paige to bed. Do you have any more questions or concerns before you leave?
I don't think so. Thank you for the time that you took to help me and Paige. I appreciate it.
Mrs. Stewart is leaving with a better understanding of how to utilize the emergency room in terms of wellness, access to care, and her family's health and safety. By acknowledging Mrs. Stewart's frustrations and helping provide teaching, the nurse practitioner practiced beneficence, fidelity, and justice. She also provided autonomy when she asked what Mrs. Stewart's preference for treatment and gave her resources for home treatment. In our scenario, the stance we took benefited both the ER and the patient. The consequences have been addressed and are minimal.